Okay. Hello, and welcome to Crucial Conversations with the Nashville Chapter of the National Association of Black Journalists. My name is Sandra Long Weaver. I'm a founding member of the National Association of Black Journalists, and I'm also the chair of the governing board, the Board of Governing Directors of the Matthew Walker Comprehensive Health Center. And our guest today is Katina Beard, who is the CEO of the health center. So we wanted to chat today and talk about where we are health-wise in Nashville. And I'll just give a little background and then turn to you, Katina. The health center serves over 17,000 patients a year in Middle Tennessee. That includes offices in Nashville, Clarksville, and Smyrna. There's also a mobile unit, and some of you may not know about that, and we'll chat a little bit about that. And to this year, 2020, the health center has faced challenges just like everybody else in our community, but the health center has continued to be open and serve patients. And Katina, I want to ask you, so how has the health center been able to do that?
Well, Sandra, you know me, and so you know my initial response is only by the grace of God, because we have been through a significant amount of, I don't want to say, I guess it is turmoil and maybe even tragedy. I mean, it started with the tornado in early March, where we lost power for 2 days, which meant we could not serve any patients out of our Nashville office, which is our largest office of the ones that you mentioned. And so we were unable to see our chronic disease patients, unable to fulfill prescriptions, just, you know, and we were just really kind of out of business for that day. Thankfully, we did have some partners that helped us to purchase some generators. So we were able to have some electricity the second day. We were able to fulfill some prescription refill requests to send to other pharmacies. And so that kind of helped us over the 2 days. And then we had some great partnerships with the National Electric Service, NES, that really expedited our request to get our electricity back connected. And so by day 3, we were back up and running, but our community around us was completely shattered, and trees down, schools closed, homes without power.
Right.
And people facing losing food. And this is at the beginning of the month. And so, you know, our community, our elderly population, those who are on limited budgets, we do our shopping at the beginning of the month. And so now we are looking at being challenged without having our food supply, and people without electricity or had significant damage to their homes may have lost the medications that they had. And so we really tried to respond to all of those needs. And so we did bring down Howie, our mobile unit, to be active in the community, to be a source of people for blood pressure screenings, to have a chat with our behavioral health specialist, to talk about the anxiety and stress of the tornado. And it wasn't just for the victims, but for the responders, because Nashville, North Nashville and East Nashville were significantly hit. And the outpouring of support from people just was overwhelming, and they were overwhelmed by what they were seeing. And so we wanted to be sure to be a resource for the responders, partnering with our local schools to help provide food for the students, because we know that our students, that's sometimes the only place they eat is at school. And so wanted to be sure that the schools that we partner with, Buena Vista Enhanced Option Schools was one of them, that they had what they needed or assisted them in providing food. And then we had this great partnership with a food truck that came from about, 30 or 40 miles away from us, that wanted to distribute food in the community and could not find a partner organization that would allow them to use the parking lot. And so we reached out to our partner church across the street, Clark Memorial, and asked if we could use their lot, and they said yes. And over 2 days or 3 days, they fed a couple of hundred people. And that was just exciting. And people were just coming, and they fed kids, they shipped food to nursing homes that were without power. We helped our staff put food in their cars and drove them there. And so we really shifted from, and all this time continued to provide healthcare. You know, we were
I was about
inside,
to say, community
Yeah,
reaching
so
out to the
we
community and providing health care at all
absolutely,
levels. Yeah.
absolutely, absolutely. And so, so we were doing all of that. And then we're still in tornado recovery mode, and COVID comes, coronavirus is here.
Okay.
And I remember being in the grocery store and just felt the panic and just the sheer urgency for food. And I was just like, I don't really know what's happening. But then I did get in gear because I was like, well, let me get some groceries because I don't know what's happening. And so, and then came back to work and we were like, oh, we have to take cover now as an organization. We have to shift. And so everything for tornado recovery stopped. And some of that impact is still there. Some of the recovery that needs to happen in North Nashville has still not happened because coronavirus kind of just shut everything down. And so then we had to move into
Yes.
what our real.
So our conversation, all of that was happening in March. We're now at the end of June, and the community is still recovering from the effects of the tornado, COVID-19, and we have social justice issues that have arisen in that.
Absolutely. So the community has just been, as I described this organization, weather torn from one storm to the next. And so coronavirus came, and then we were again positioned to how do we help our patients? What do we do to make sure that our patients continue to have the service? So there was never a thought that we would stop providing service because we know that we are a source of care, a single source of care for thousands of people. And if we close our doors, where will they go? That would just be a secondary burden to the emergency departments that didn't need that. And so we saw ourselves not as, necessarily responding to the coronavirus, but responding to the potential burden on the healthcare system by not being here to provide services. And so
to provide the basic services if you didn't feel you had symptoms for COVID and needed to go to the hospital. This way people had a place to go where they felt safe that I'm not going to run into people who have the virus. Is that
right? Because that, and plus we know now, right? And we didn't know this then, but we know that if you have complications with diabetes or hypertension or asthma, that your outcomes from coronavirus, particularly early on, were not good.
Right.
But we've always been very vigilant about medication management. And so we wanted to be sure that our patients always had access to their medications, always had access to testing to know what was going on with their health. And so we were there for that service. So we really, really focused in real early on our diabetic patients, our asthma patients, to make sure that they had access to services. And so it's been kind of, coronavirus since then. And so, people ask me, so when did you all open? And I said, we never closed.
The doors.
We shifted some hours so that we could early on recognize that we had a shortage of PPE, personal protective equipment, masks, gloves, cleaning supplies. And so to help kind of sustain some of our supply, we recognized early on that this was a complete new stressor mentally and emotionally on our staff. And so we shortened our work days. We didn't have our extended clinic on Monday and Tuesday, nor did we have it on Saturday. That helped us to kind of do some deep cleaning and to allow the staff to have some self-care time, because we saw that early on as being important.
That they needed. And so, but patients never stopped coming during this time period, and they're still
never stopped coming. The first week, when we went back and we started to look at the trend compared to 2019, we had about almost a 50% decline, which is expected. All of our dental services had to stop because we understood from the CDC and all the experts that the coronavirus was definitely about the fluid in your mouth and about, that's how it's contracted. And so we had to immediately stop the dental services. But in medical and behavioral health services, those services went down to almost 50%. But the next week, those numbers started to rebound. And week after week, we started to see that we were some weeks very close to 2019 numbers and some weeks exceeding 2019 numbers. And so without us, and I'm saying this is, 500, 600 patients a week. And so if without us, where would those 500 or 600 patients have ended up? And so,
and the patients that come through, have insurance, do not have insurance. You're not
Well,
turning it away.
right, we're not turning anyone away. We did see from our data that compared to 2019, in the first couple of weeks in 2019, our new patients that were uninsured were about 25% compared to about almost 40% in 2020.
Wow.
So we immediately saw the impact of the economic decline on our patients and their access to insurance. So, but no, you know, as a board member, we don't turn anyone away, COVID or no COVID. We are a source of care for individuals, and we want to make sure they have access to quality health care, which is what we provide.
Okay. And now, is Matthew Walker doing any of the COVID testing at this point?
So recently we started partnering with one of our sister health centers, Connect Us Health, to provide community-based COVID testing. And so the very first one we've done, right now it's the only one we've done, is with Mount Zion Church. We did 2 testing days. The first day we did 116 tests, and about 10% of those came back positive. The second day we did over 300 tests, and there were about 20 to 25 positives from that group. And so over 2 days, over 400 tests. And so we felt very good about being able to provide that resource. And so now we are continuing to partner with the Tennessee Department of Health and Path Group Lab Services to implement these services in various minority-based communities. I know Nashville has some hotspots in immigrant populations, but we also know that Nashville is a very transient community. And so we can go from living in East Nashville to shopping in South Nashville and coming back to our home in East Nashville. And so, you know, while it may be concentrated in South Nashville, we still want to be able to provide testing and resources outside of those hotspots so that we are all educated and clear about our status of COVID.
Okay. And and also during that period, are you seeing more people who have stress, anxiety? I know the Nashville Chapter of Black Journalists partnered with you earlier in June to do a session on Black males and their health. And that was one of the conversations, talking about the mental health services. Are you seeing more requests for people who are just anxious about everything that's going on?
Sure. Early on, you know, we had people from the community calling because they wanted to be tested. They thought, you know, they had all the symptoms, and we had to navigate them to another testing resource. We had people show up that were very concerned about the coronavirus, and we had to, you know, kind of navigate them to a resource. Our behavioral health team quickly moved to providing services via telehealth. That was one of the very first services we were able to stand up through telehealth to make sure that our patients had access to those services. And so that was our patients, but then our employees, we also saw the stress and the emotion and the fear of having to continue to work in this environment and being fearful that they would contract the virus. And so we worked quickly, the team worked quickly to put in place policies around face masks and screenings at the door for our staff and for our patients. And we also went an extra step in the organization to feed our staff every day for the month of, I think, March and April, every day, so that they would not have to go out into the community to find food, risk being exposed to, you know, another element. And that's a way of just saying thank you for your service. And so, so I think that that was well received and necessary. So, and now what we're seeing are people who are stressed about this continued social isolation. And so as we see the numbers are going up everywhere, even in Nashville, I think that that is a direct result of people just having this innate desire to be out and be around people. And we haven't done a good job, I don't think, in creating safe spaces for people to do that, you know. And so it's just, you just go back to your usual suspect places, clubs and bars and tight family gatherings without being mindful of the coronavirus and mandating mask wearing or mandating
and social distancing. So just to make a point, so Matthew Walker has been in the community for 52 years. So it
Yep.
is a thriving organization. It's also the first community center, federally funded community center in the country named after an African American. So this year we're celebrating the 50th anniversary of that. And when I think of Matthew Walker and the work that the agency is doing, that our board is working with the agency to do, I think of Matthew Walker being at the center of building a healthy community. A healthy community is a thriving community. It's a happy community and a sustainable community. How do you feel about that? Are we headed in that direction?
Sure. I think 52 years of serving a community is the definition of sustainability. You know, it's one of the examples of sustainability. What helps a community thrive and grow and improve are sustainable resources. And so that's what we are seeing now, and where people want to start to build greenways and improve sidewalks. Those are sustainable projects that help people to be able to be healthy in their community. The more that we improve our schools in our communities, those are sustainable processes that help our communities to be happy and healthy. And so Matthew Walker absolutely sees itself as a sustainable, thriving, founded resource for our community that helps, that enhances and is a partner in the health and improvements of our community. And I'll add to your list of facts that Matthew Walker Health Center was the first founded federally qualified health center in the state of Tennessee.
Yes, yes, very definitely. So before we finish, Katina, if someone would like to partner with you, partner with Matthew Walker for testing, or if someone wants to come in for an appointment, can you give us some contact information, please?
Sure. I think the best way to reach out to us is to look to our website at www.mwchc.org. I don't know, do people still say www in the beginning? mwchc.org. And you can find all the contact information there, and you can read more about our sites, more about our services, and the work that we're doing. I know I've been having a lot of conversations with people in this social justice space around what can, predominantly white organizations do to help minority serving organizations, and, is writing a check enough? I mean, certainly, funding is always welcome, but I think what we need as Matthew Walker Health Center, as a nonprofit, minority serving organization, are deep-rooted partnerships that help us further our mission. And where people are willing to share resources and knowledge and expertise with us that we are either unable to afford, or just don't need full-time, long-term. And so I just want to say that, as a way of giving people another thought process and how they can support not just us, but other minority serving organizations.
Oh, well, thank you. And thank you, Katina, for joining us with Crucial Conversations today. Again, this is Katina Beard, who is the CEO of Matthew Walker Comprehensive Health Center. I'm Sandra Long Weaver, and I will see you all the next time. Thank you.
Thank you, Sandra.